I'm an assistant director in a long-term care home. So that's when I got more interested in the issues in long-term care and the quality of life of residents in long-term care home. Currently I'm doing my research in related to access to mental health care in long-term care homes. So in this presentation, what I'm trying to explore is did we miss an opportunity for equity and reform in long term care when we had the Fixing Long Term Care Act introduced in 2021? So, again, welcome everyone to the presentation on mental health care in long term care, Ontario long term care, a missed opportunity for equity and reform. If anybody is not familiar with long-term care, I just want to give a brief introduction of what is meant by long-term care in Ontario and in Canada. So long-term care homes, also known as nursing homes, is a residential facility that provides 24-hour nursing care, personal support, and supervision for people who are no longer able to live independently in our community because of their age, illness, disability, or other cognitive conditions. The core services provided in the long-term care include healthcare support like nursing, medication administration, regular physician visits for any emergencies or irregularly, monthly or quarterly. Medication treatment or therapies like physiotherapy, occupational therapy, and personal support services to help with activities of daily living, feeding, bathing, dressing, and help with nutritional meals and snacks. They also have social and recreational activities and laundry service. So that is what a long-term care. It is a bit different from the supportive housing or the group homes. It is in long-term care in Ontario is regulated by Ministry of Long-Term Care, and the sector is governed under the Fixing Long-Term Care Act of 2021 and the Ontario Regulation 246/22. Ontario long-term care sector includes approximately 626 homes with about 78,000 beds. These homes can be profit, non-profit, or municipal homes, but all are regulated by the Fixing Long-Term Care Act. The ministry uses inspections for regulatory as a regulatory tool to ensure that homes comply with legal requirements related to patient safety, quality of care, staffing, and operational standards. Inspections may be proactive, such as unannounced comprehensive inspections, or reactive, following compliance, critical incidents, or report of non-compliance. If inspectors identify violations in a home, the ministry can take enforcement actions ranging from compliance order and financial penalties to mandatory management interventions, or in severe cases, revoking a home's license. Inspection reports and enforcement actions are publicly available, promoting transparency and accountability within the sector. Overall, the goal of this Fixing Long-Term Care Act framework is regulation is to protect residents' right, safety, and quality of life while ensuring that long-term care homes meet provincial standard. So the most important thing we have to understand when we think about long-term care home is like it is strictly regulated by the Ministry of Long-Term Care and it is governed by the Fixing Long-Term Care Act. So when a ministry comes to a home, what they look in a home is whether they are compliant with the Fixing Long-Term Care. That's where the Fixing Long-Term Care Act become the pillar for any long-term care home. And therefore, it's critical to analyze what is enacted in the act for a long-term care home, because if something is missing in the act, the homes are not they are not required to maintain that program in a home. So that's where it's critical to understand what the Fixing Long-Term Care Act entitles for our residents in long-term care homes. So first, I want to look at the profile of the residents with mental illness in long-term care homes. So Kenny et al. Conducted a cross-sectional study across 1,300 long-term care homes in Canada. And I'll move to the next slide to see just a brief summary of the article. In the study, in this cross-sectional study, he has found that approximately 40% of residents have diagnosed with mental disorders such as depression, anxiety, bipolar disorder, or schizophrenia, while other 36% had Alzheimer's disease or related dementia. When we have residents with Alzheimer's or dementia, they also will have cognitive changes resulting in behavioral issues and other mental health challenges. So there is a significant number, like 40% plus 36, that's about 76% of total residents in long-term care is um, at risk or vulnerable for mental health issues. That was a significant finding in this study. So together, this means that more than 3/4 of long-term care residents were living with either mental disorder or dementia. Compared with residents who did not have these conditions, those with mental illness were more likely to experience more cognitive impairment, depressive symptoms, and aggressive behaviors. They also require greater assistance with daily activities like dressing, eating, personal hygiene, etc. Social isolation was another important concern they identified in the article, as these residents were less likely to engage in social activities and more likely to have limited contact with families or friends. The study found that there is a higher use of antipsychotic medications, including antipsychotics and antidepressants, as well as greater likelihood of using restraints on residents due to their conditions. Importantly, many residents faced both mental health challenges and physical health conditions, simultaneously creating a complex care needs that requires specialized, person-centered approaches and access to mental health expertise within the long-term care settings. Another article this is a scoping review done on the care needs of older adults with mental illness in long-term care facilities. This study was conducted to identify what are the care needs, what is the staffing current level of knowledge in giving this care for the residents in long-term care homes. According to Chisoka and colleagues, mental health care is an essential component for quality long-term care. In this scoping review, approximately 15% of adult age 60 and older lived with mental disorder, and the number of older adults required long-term care is expected to increase significantly over the coming decades. The review found that older adults with mental illness such as depression, anxiety disorders, schizophrenia, and bipolar disorders face unique challenges when living in a long-term care setting. These residents often require specialized mental health assessment, treatment, and ongoing support to manage psychiatric and behavioral symptoms effectively. However, many long-term care homes are not adequately equipped to meet these needs. The review identified gaps in access to psychiatric services, limited availability of mental health service specialists, and insufficient staff training in geriatric mental health. Staff frequently reported feeling unprepared to manage complex mental health conditions in the homes, which can contribute to stress, burnout, and reduced quality of care. The authors also found that facilities with limited mental health resources were more likely to experience severe behavioral symptoms among residents. Therefore, improving access to mental health service, increasing staff education, and implementing person-centered interventions are critical to enhancing residents' quality of life and supporting their emotional, psychological, and social well-being. Next, I want to bring your attention to another article by Cohen et al. They discussed about the mental health care and policy injustice in Ontario. they examined Ontario's mental health strategy using an intersectional based policy analysis framework. They found that mental health often framed as a problem of access to service, system coordination, or economic burden. While these issues are important, the authors argued that such perspectives fail to address broader social and such structural factors that shape mental health outcome. For older adults living in long-term care homes, factors such as social isolation, poverty, discrimination, cultural barriers, and unequal access to resources can significantly influence mental well-being. Therefore, according to the authors, improving mental health requires more than increasing services. It also requires addressing the social conditions that affect health. So, these are some of the factors that we have in front of us. When we relate this to the human rights and mental health in long term care home, human rights should be a central to mental health care, and mental health care can unintentionally contribute to loss of autonomy, exclusion from decision making, corrosive practices, stigma, and discrimination. Residents with mental illness may face greater vulnerability to ageism, mental health stigma, and physical and cognitive impairment. Person-centered and right-based approach are essential to improve the quality of life in long-term care homes. From an intersectional perspective on mental health experiences are shaped by multiple intersecting factors. In this study, they have identified age, gender, race and ethnicity, disability, income, and socio-economic status, culture, language, and other geographical location like rural, urban, those geographical locations can influence the mental health experience of residents in long-term care. Another finding was the factors that could create unequal experience were access to care, quality of care, and health outcomes. So, from this study, the implications for the long-term care residents were like to improve the mental health care. Are the organizations should promote residents' right and autonomy, address social isolation and exclusion, provide culturally safe and equitable care, increase staff education in mental health and trauma informed care, strengthening access to specialized mental health service, and include residents and families in care planning and policy decisions. The key message from this article was to improving mental health requires both clinical and systemic changes. Long-term care homes can support mental well-being by promoting residents' autonomy, reducing isolation, addressing inequities, and ensuring access to specialized mental health resources. The authors in this article emphasize that the importance of involving people with lived experience in policy development and decision making. By adopting an equity-focused and human right-based approach, long-term care organizations can create environments that better support the mental health and well-being of our residents. So I wanted to bring these articles to your attention because these were the facts that we have in front of us. Like we have evidence to prove that we have the incident rates of mental illness in long-term care is significantly high, and the care needs and the specific training requirements and the specialist required for caring for these residents in long-term care were significant. And in the mental health framework in Ontario, we already facing an inequity in the access to services, especially for people in long-term care home. So now I want to look at what happened when the Fixing Long-Term Care Act was introduced. So if I know most of you might be aware, this act was introduced after the pandemic because of that increased awareness of the vulnerability of long-term care sector. So if you look back at that period, every day in the news article we could see the isolation of the residents in long-term care, increased level of depression of residents in the long-term care, the reduced quality of life in long-term care. So it was it everybody was thinking about long-term care and residents, and Ontario government promised that the Fixing Long-Term Care Act is going to fix the long-term cares. So the question is whether it actually did fix the long-term care act, like the long-term cares. Yes, it did bring some positive changes. We should acknowledge that. So as this Fixing Long-Term Care Act introduced, some of the programs previously were not a required program in long-term care were introduced. For example, like infection control was not a required program before, so it became a required program. Palliative care become a required program, and quality improvement in long-term care become a required program. Also, the staffing hours for direct care in long-term care, they have increased it to minimum of 4 hours. Um, and the focus of this Fixing Long-Term Care Act, when introduced, was to address the long-standing concerns, basically focused on the patient safety. Um, but in the peak of everything, what we missed was the key concern, the quality of life of our residents in long-term care home. For a quality of life in long-term care home, we should have good mental health. People should be able to enjoy their life to the fullest. But in the Long Term Care Act, we fail to address that to a great extent. So, if I frame it in this way, the legislation did strengthen the accountability mechanism, inspection powers, resident protection, and staffing commitment. However, when viewed through a mental health lens, several important gap remains. Although the Act emphasizes safety, quality of care, and residents' right, it provides limited direction regarding how mental health care should be delivered within long-term care homes. There are no specific requirement for a comprehensive mental health assessment, minimum psychiatric staffing level, or guaranteed access to specialized geriatric mental health service in this act. Given the research shows the high prevalence of mental illness, dementia, depression, and behavioral symptoms among LTC residents, the absence of explicit mental health standard represents a significant policy gap. When comparing residents' mental health with the legislation, a mismatch becomes apparent. Research demonstrates that mental illness is highly prevalent among LTC residents. Yet the Act largely focused on physical care, safety, and regulatory compliance. Similarly, evidence indicates that the staff often lack specialized mental health training and access to psychiatric consultation. However, the Act does not require specific mental health competencies or dedicated mental health professionals within the home. So, just to summarize, the Fixing Long-Term Care Act primarily focus on protection and safety and provide limited attention to the mental health, does not explicitly address ageism, mental health stigma, racism and discrimination, cultural safety, and social exclusion. Intersectionality is largely absent. Residents may experience overlapping vulnerabilities related to age, mental illness, cognitive impairment, ethnicity and culture, gender, and socioeconomic status. Now I want to bring your attention to what we can do different to in future policy directions, like how can we align our LTC policy framework to the national standard for mental health and well-being. So the first recommendation based on the national standard and other evidence-based frameworks is to embed mental health as a core component for LTC care. That is to incorporate mandatory mental health screening, assessment, and care planning. Establish mental health equity indicators alongside physical health measures. The second recommendation would be to increase specialized mental health support to ensure access to geriatric psychiatry and interdisciplinary mental health team. Expand staff education in geriatric mental health, dementia care, and trauma informed practice. The third recommendation would be to promote person centered and right based care, support residents' autonomy, dignity, and shared decision making, to reduce reliance on restrictive or corrosive practices like use of antipsychotics or even use of restraints in the home. The fourth recommendation would be to address social determinants of mental health, to implementation of strategies to reduce loneliness, isolation, and stigma, and foster a meaningful social engagement, family involvement, and community connections. The fifth recommendation would be to advance equity, diversity, and inclusion by delivering a culturally safe and responsive mental health service, and to address the need of diverse population, including racialized, indigenous, LGBTQ, and other linguistic residents. The sixth recommendation would be to strengthen accountability and evaluation, monitor mental health outcomes at the system level and facility level, and incorporate mental health indicators into the LTC inspection and quality improvement initiatives. So, before I end this presentation, I want to share a story that why I want to keep you in your mind when you work in the field, when you advocate for mental health care in long-term care homes. So I request everybody to keep this story confidential because this was a real incident happened. And I just wanted to bring your attention to how the gap in mental health care could risk the quality of life, the safety of the resident, and as well as the whole home. So
and Lallu, I just want to make a point that this is recorded, so anything that you share will be kind of shared more broadly. So I just want to kind of put that caveat in there.
Okay. Yeah, I won't be discussing any names or anything. Just to get the need for access for mental health care in long term care. So, what happened was like in a long term care home, there was a resident. The resident is known to have a mental health diagnosis, has been consulted externally many times for the concern. And each time the resident will have an escalation in behavior. The home has to follow through a protocol. Like they usually start with the urine culture to see whether there is a urinary infection, things like that. So then the result has to come back to be negative. So it took each time when there is escalation, this happens in the home. Like they have to go through all this process, and eventually they get to the outreach team and they come and see the residents and they change the medication, or she will have an escalation, or send, we have to call the form the resident. Like mostly that's what happened long-term care home. Then they have an escalation in a mental health condition due to the lack of resources in the home. It usually escalate and they go into a crisis stage, and the home has to form the resident, and the police will arrive for crisis management and transfer the resident to a hospital for emergency psychiatric assessment. So this is a routine event happening for this resident also. So what happened was, the home knows, the staff in the unit knows, the family knows that the residents is going into a crisis state gradually. but they still have to follow the protocol because they don't have the resources readily available, and they can only escalate it to transfer or get a consultation only after reaching this process. So during this process was happening, this resident went into crisis. It happened in during nighttime. The resident was having delusion and hallucinations, and she set fire. So so the greater risk happened for the resident. The staff responded immediately, and there was fortunately there was no mishaps, but it could have escalated into a situation for a self-harm for the resident and for other vulnerable residents in the home. So if there was adequate resources available to the home, or the staff were adequately trained, and if mental health was a required program for long-term care home, this kind of situation is easily avoidable. When the staff notice a change, they could consult with the psychiatrist or the specialist or geriatric consult and get the care for the resident. Could have avoided such a dangerous situation for that resident and for the whole home itself. So that's why this advocacy is important. And in long-term care home, the act comes to play in all the ways. So when the governments make policies, they have to make into consideration that this is not just sorry. Strangers telling me to call stranger. Don't call stranger. Can you wait for Mama? I'm sorry. Call him. And don't need to call you. You wait for Mama, okay? I'll come in a second.
This is the best interruption ever, Lallu. I love it.
Sorry about that. And don't call anybody. Please wait for Mama. I'll come and see you in a second. No strangers calling you, okay? Have a seat for Mama. Sorry about that.
That was very nice.
You can sit here for me. Please, thank you. Sorry about that.
That's okay.
So nice. What I was trying to tell was, like, when the governments or policy makers create and draft the policies and acts, it is important to consider the vulnerability of our residents and how important it is to have timely access for services in the where they are. So, in future LTC reforms should move beyond safety and compliance. They should have a comprehensive mental health framework to promote well-being, equity, and human right and person-centeredness for the residents in the long-term care homes. So with that, I want to conclude my presentation, and it's open for any questions or any thoughts, any experiences you have. Thank you.